all want to do the absolute best for our children possible. So when you see that your child is struggling with mental health issues, who do you turn to? May is Mental Health Awareness Month. We wanted to bring in our friend Dr. Deborah Greenhouse, who not only is a pediatrician but also a spokesperson for the American Academy of Pediatrics. Thanks for being with us today.
Thank you so much for having me.
What are you seeing in your office?
Over the last several years, we've seen just a huge spike in children with mental health concerns in our office. Some of those are kids who come in with a specific complaint of depression, a specific complaint of anxiety, focus, school problems. Some of them are not. Some of them are kids who are coming in with recurrent abdominal pain or chronic headaches or sleep problem or fatigue or not wanting to go to school. So not everything comes in billed as a mental health problem, but sometimes as you dig down deeper and you ask all of the questions and you rule out other things, sometimes some of these other physical complaints are actually the outward signs of a mental health problem.
And talking about those physical complaints, I mean, we all have had a kid say, I don't want to go to school today, my stomach hurts. When do you know, though, Dr. Greenhouse, when it becomes a problem and when it's time to seek advice from an expert?
The child who is waking up day after day with abdominal pain, except that it only happens Monday to Friday, and then Saturday and Sunday it doesn't happen. If they stay home from school, it's miraculously better in an hour. Oh. Those are the kind of things where you have to stop back and think, hey, wait a minute, maybe there's something underlying this. Maybe he's actually anxious about going to school.
You know, we can't blame everything on social media, of course, but it has really changed what information our kids are exposed to at what age. How, as parents, do we do better at policing that?
So, social media for young children particularly, it's all bad. There is nothing good for young children in social media. So social media, all platforms, Snapchat, Instagram, TikTok, almost anything you can think at. Those are the top three that kids and young adolescents are looking at. All of those platforms can be showing kids things that either aren't real. People put their best version of themselves out there, not necessarily the real version of themselves. It also exposes them to influences 24/7. When I was a kid, if I was having issues at school or if I was being bullied, I can go home from school and that was it. I wasn't going to be exposed to that again until the next day.
If there's a parent watching this and they know that their child is struggling and it's time to ask for help, where do we go?
So I would say if you think your child is struggling, one of the first things you can do is call your pediatrician. They do know how to help. They do know what resources are available in the community. Some pediatricians are more comfortable than others dealing with children with mental health problems, but all pediatricians will be able to give you some basic guidance on where do you go from here.
Thank you so much. Now is the time to ask for help if you need it. If you see your child struggling, there are resources out there. Make sure to use them. Dr. Deborah Greenhouse from the American Academy of Pediatrics, thank you so much for talking about this important topic with us today.